Welcome back to the GP Pharmacy Club pod. I'm your host, Adam, and today we're diving into the latest NICE guidelines on preventing and managing recurrent urinary tract infections, or UTIs. This update is packed with valuable insights on reducing recurrence, optimizing antibiotic use, and incorporating non-antibiotic strategies. Stick with me for the next few minutes as we break it all down. Recurrent UTIs are defined as having 2 or more infections in 6 months or 3 or more in a year. They are particularly common in women, trans men, and non-binary individuals with a female urinary system. NICE has categorized UTIs into lower infections, which affect the bladder, and upper infections, which can reach the kidneys. So, when would we consider referral for recurrent UTIs? One of the key takeaways from this update is the importance of referring certain patients for specialist assessment. These include men, trans women, and non-binary individuals with a male urinary system who have recurrent UTIs. Those experiencing recurrent upper UTIs. Cases of recurrent lower UTIs where the underlying cause is unclear. Pregnant individuals and children under 16, as their treatment requires special consideration. Patients with suspected cancer or those who've had gender-affirming surgery affecting the urethra. The guideline also offers helpful suggestions for preventative strategies. NICE recommends a tiered approach, starting with lifestyle and behavioral changes. Patients should be advised to stay well hydrated and urinate after intercourse. Avoid irritants like perfumed soaps. Use breathable clothing and avoid spermicide products. For those going through menopause, vaginal estrogen may be considered if hygiene measures alone aren't effective. It's available in multiple forms like creams, gels, and pessaries and should be reviewed after 12 months. In terms of medical treatments, NICE offers both antibiotic and non-antibiotic options. When lifestyle changes aren't enough, we move to pharmacological interventions. NICE suggests single-dose antibiotic prophylaxis for patients who can identify specific UTI triggers, such as sexual activity. Methionine hippurate, a urinary antiseptic, as an alternative for those who can't or prefer not to take antibiotics. Daily low-dose antibiotic prophylaxis for those with persistent infections after other options have been exhausted, with reviews every 6 months to prevent antibiotic resistance. NICE also addresses alternative and self-care treatments. While evidence is mixed, some individuals may benefit from D-mannose, a sugar that may help prevent bacterial adhesion. Cranberry products, though data on effectiveness varies. Probiotics, specifically lactobacillus, which may play a role in maintaining a healthy urinary microbiome. NICE reminds us that patients should be cautious about the sugar content in these products. Naturally, we'll all be interested in guidance on choosing antibiotics. For those requiring antibiotics, selection should be based on local antimicrobial resistance patterns and individual patient history. First-line choices for adults include trimethoprim, but avoid in the first trimester of pregnancy. Nitrofurantoin, which should be avoided near-term due to risks of neonatal hemolysis. Second-line options include amoxicillin and cephalexin, with dosage adjustments for children and those with renal impairment. In conclusion, this NICE update emphasizes a well-rounded approach to UTI management, incorporating prevention, lifestyle adjustments, and responsible antibiotic use. As pharmacists and prescribers, staying informed on these guidelines ensures we provide evidence-based, patient-centered care. Thanks for tuning in. If you found this episode helpful, be sure to subscribe and share it with your colleagues. See you next time on the GP Pharmacy Club pod. Stay informed and stay healthy.